you're probably wondering right now why I'm wearing these masks and gloves. Well, I can prepare not just for today's video. This is how we protect ourselves from the spread of viruses. Today, I'm going to talk about why do we need all of this equipment, starting on how does the virus spread through its transmission, second, the common and viral infection, and third, what is the role of the nurses and healthcare workers in preventing the spread of viruses?
Viruses are very sneaky. They can survive or reproduce on their own. They need someone, specifically a host, or let's say, us human being. So to get to a host, they must have many routes to spread, such as number 1, airborne transmission. So ever been near someone who cough or sneeze without covering their mouth? Well, tiny droplets floating and filling up the air, while viruses like COVID-19 and influenza can float around and be inhaled by the next person nearby. Second, direct contact. A handshake, a hug, or even a kiss can spread viruses like herpes or Ebola, especially if there are open wounds or contact with mucous membrane. Third one, contaminated surfaces. So imagine touching an elevator button, holding our phone frequently, and touching a coin, then rubbing your eyes. If the surface had a viral particles like norovirus or rhinovirus, you just invited them in your body. Fourth one, bodily fluids. Blood, semen, breast milk, these are the highways of viruses like HIV and hepatitis B. That's why protective measures and safe practices are so important in clinical settings such as hand washing, wearing gloves, and wearing face masks. And last one is vector. Some viruses travel with insects, such as dengue virus, for example, is carried by Aedes mosquito. One bite and you will be infected.
So, as you can see, viruses don't always walk through the platform. They may be in your shoes, in your hands, or even in your phone. That's why we talk about the spread of viruses so that we can prevent it. Because once we understand how, we will be equipped to stop when and where. Now that we are done talking about the spread of viruses, we are now going to talk about the common and viral infection.
Now that we know how viruses spread, let's talk about some common and emerging viral infections that affect millions of lives across the world. First, influenza. It's more than just the flu. It causes seasonal outbreaks every year, leading to hospitalizations, especially among the elderly and young children. It mutates quickly, which is why vaccines have to be updated regularly. Next is COVID-19. Caused by the SARS-CoV-2 virus, it changed our lives globally. It spreads rapidly through respiratory droplets and can cause symptoms ranging from mild cough to severe pneumonia, or even long-term complications in some people. Hepatitis B is another serious viral infection. It primarily attacks the liver and spreads through blood or other bodily fluids. It can be chronic and lead to liver failure or cancer if left untreated. The good news, there's a vaccine for it. HIV, or human immunodeficiency virus, weakens the immune system by targeting white blood cells. Without treatment, it can develop into AIDS. Antiviral therapy helps people live long and healthy lives. Dengue, carried by mosquitoes, causes high fever, rashes, and severe muscle pain, sometimes called breakbone fever. Severe dengue can be fatal, especially in children. It's common in tropical countries like the Philippines. Lastly, rabies. A rare but deadly virus that spreads through animal bites. Once symptoms appears, it's almost always fatal, but the key is prevention, through immediate medical care and vaccination after exposure.
Let us discuss the crucial role of nurses and healthcare workers in prevention of viral transmission and managing viral infection. First, let us have a short introduction about the crucial role of nurses and healthcare workers in preventing viruses. Nurses are on the front line of infection control. One of their most important responsibilities is recognizing infection risk. This means identifying when and how germs might spread and taking immediate action. Even before a diagnosis is confirmed, nurses assess patients for symptoms and inflammation isolation when needed, and educate patients and family about preventing transmission such as proper hand washing and social distancing. Now, here are the types of prevention for viral transmission and managing viral infection. First, we have hand hygiene. Hand hygiene remains the cornerstone of infection prevention. Nurses make sure to clean their hands before and after every patient interaction, using soap, water, or alcohol-based hand sanitizer. These simple yet effective practices significantly reduce the spread of viruses. In addition to hand hygiene, nurses in healthcare uses PPE like masks, gloves, gown, and face shield to create a barrier against the infectious agent. Proper use and disposal of PPE are critical to maintaining a safe environment of both patients and staffs. Next is vaccination. Vaccination is a powerful tool in the fight against viral infection. Healthcare workers are encouraged to stay current with recommended vaccine, protecting themselves and reducing the risk of transmitting infection of vulnerable patients. Also, we have the environmental cleanliness. Environmental cleanliness is another key factor. Nurses ensure the patient rooms, medical equipment, and common areas are regularly disinfected to minimize the risk of viral contamination. When managing viral infection, nurses monitor patients closely, providing supportive care and promptly reporting in any changes in condition. They also assist in contacting, tracing, and data collection, the supporting public health efforts to contain the spread of the viruses. Nurses and healthcare workers play a critical role in preventing viral transmission, managing infections through vigilant hygiene practices, proper use of protective equipment, patient education, vaccination, and adherence to infect the control of protocols. Their dedication and expertise are essential to safeguarding public health and ensuring the well-being of our communities.